Myself, Dr. Jibran Ahmed presents to you Simply Pathology, and today we are back with a very important lecture. As you can already see that today's topic of discussion is a 90-day postgraduate pathology revision plan. So today we are going to understand about how to deal with this vast MD pathology or DNB pathology subject, okay, in this next 90 days, okay. Now remember one thing, this lecture is not only meant for the exam going residents, but it is also meant for the second years as well as the first years, because you people should also have an idea that what is it that you have to face, okay, in your final exams. Now among the exam going residents, remember one thing, okay, that this lecture, okay, is useful for all the residents who have read thoroughly for the past 3 years, okay. It is also relevant and helpful for those who have been reading on and off. That means they have read less. So they have been reading on and off, and it is also applicable for those residents who have not read at all. Okay, it is very useful at least for these residents. Okay, so everyone who is appearing for this December 2024 MD pathology exam, please thoroughly watch this video, and where you do not understand a point, please pause the video and see the video again. Okay. So what are the components of discussion today? The first important component that we are going to discuss today is what are you up against? Okay. So what are the components of the postgraduate exam? So you have to understand that very thoroughly. And why it is very important for the exam going residents to understand this point? Firstly, although you must have read a lot of things from a lot of subjects, but you have read in a very, unkempt way, okay, in a very haphazard manner. So you may have left certain sections, okay, that you do not know of, okay, and that might be very important for your exam point of view. So it is very important to first see what are the different components of the PG exam, so that you can individually target those components. And not only that, in the component section, which is going to form the major part of today's discussion, I am going to discuss all the important topics, okay, which is a must do topic for you for the exams, without which, okay, you should not appear for the exam. So these are the topics that you have to complete, and I will also show you that it is very easy to complete these topics in time, because you have a good amount of time. So coming to the second point, so how much time you are having? You are having approximately 3 months of time. So September is there, October is there, November is there, and in the December you have your exam. So I'm not counting December. So in total, okay, 90 days of these 3 months and 10 days of August I am also calculating right now. So on an average, I am seeing that you are having 100 days to yourself. Okay. So third important component comes that what is the mathematical approach? Okay. How do you mathematically approach? And I am going to prove you mathematically that you have a lot of time. So even 70 to 80 days time is more than enough, and you can keep the remaining 18 to 20 days of time, okay, in the end, only for the revision purpose, okay, only for the revision cycle for the exams, okay. And very important thing is that this particular discussion is important and applicable to all those exam going residents who have been relieved of duties. That means you do not have to attend the department or departmental work, so you have been relieved of your duties. Okay, not only that, it is also applicable, and the entire thing is doable for all the residents, okay, or who although have been relieved of duty, but they have to attend the colleges. That is from morning 9 o'clock till 5 o'clock, you have to stay in the department. Although you will not be given any work, you can sit over there and you can study. Okay. Lastly, thirdly, okay, this lecture is also applicable to those residents who are yet working, and who may just get, in the end, they might get just 1 month of time before the exams, okay, free for reading. So it is also applicable for them. So the only difference will be, okay, those who are having, those who are relieved or those who are just attending without doing any work, they can complete everything in a relaxed manner, whereas those who are yet working, okay, they will have to work a little bit more hard. Okay. Okay. The fourth important, component of today's lecture is the counseling session, and I will give you a lot of tips on how to achieve your targets and how to prevent procrastination, frustration, the fear of exams. Okay. One important line I would like to tell everyone over here, that concentrate on your studies rather than what your peers are doing or what your colleagues are doing. Because most of your time I have seen many residents that their energy is going thinking about what other people is reading. So I will come to that point, okay, later on. But this is the fourth component, that is the counseling. And the fifth important component that we are going to discuss is the exam manner and the exam etiquettes that every resident should have. Okay. So let us start today's topic of discussion without wasting any time. The first and the most important component that we will discuss right now is the postgraduate exam component or the PG exam component. So there are three important components of a postgraduate exam. Okay, what are these components? One is the thesis, second is the theory, third is the practical examination. Now, very importantly, before I start the individual term, just I would like to tell you that the NMC has given just the marking for the practical examination, and what the NMC have said that the practical examination should be of 500 marks, which is basically divided into 400 plus 100. What is this 100? This 100 is for internal assessment. This 100 is for internal assessment. Okay. Internal assessment meaning, okay, whatever journal club presentation you have given, seminar presentation you have given, or whatever work you have done, how you have worked in the department, based on that the department is going to give you some scoring. Okay, some score will be there. So that is the internal assessment. Okay, and that will be added to the practical mark. This is according to the NMC, but it might vary from college to college. For the theory exam, there are 4 papers and each paper is of 100 marks. So it is 100 into 4, that is 400 marks. Okay. So 500 plus 400 is approximately 900 marks. This is what I understand. Now in some institutes, okay, it might vary also. So this is just a recommendation from the NMC. So it might vary from institute to institute. So it is not a hard and fast rule. Okay. For example, in my college, there used to be 600 marks of practical plus 400 marks of theory. Total, there used to be 1000 marks. Okay. So whatever be, okay, it is your percentage that matters. Okay, for your examination, you need to get separately 50% in theory and separately 50% marks in the practical to pass the exam. This is what is required. Okay. So the first important part is the thesis. Thesis should be complete at least 6 months before sitting for the exam. Although many residents, they are yet preparing and they are yet to submit the thesis. So that again, it varies from state to state and it should be accepted. Second part is your theory exam. As I told you, you have to pass separately in your theory and practical, and the passing mark is 50%. In the theory, there are 4 papers. Okay, paper 1, 2, 3 and 4. Now, the general division of the syllabus for the different papers as given by the NMC for paper 1 should have general pathology and molecular pathology, including the basic sciences. Paper number 2 should comprise systemic pathology and cytopathology. Paper 3 should comprise hematology, clinical pathology, blood banking, as well as tissue processing and these sections, and recent advances should be paper number 4. Okay, but remember this division that is there for individual paper, these subjects are there. This division is quite variable. It is highly variable. Okay, what I mean by that is that, for example, there are 2 things over here. Please understand, there are 2 variables. The variable number 1 is that this is given by the National Medical Council, and it is not necessarily followed by all the colleges, private or government, or all the universities across the country uniformly. Some universities might be following completely like this. Some universities may not be. For example, in my West Bengal or WBUHS, usually cytopathology used to be part of paper 3 only. Used to be, okay, this was the basic thing. Now, this might vary from university to university. So what is advisable over here, whatever pattern is followed for your respective college, okay, or for your respective university, you follow that only. Okay, you follow that only. This is a very, very standard, division, but it might vary and you follow what is given in your college. Okay, so this is the number 1 variable that I told you, that this division might vary according to the different colleges and universities. The second variable is that, and which is a very twisting variable, that sometimes, at least it used to happen in our universities, that they used to be mix match, means the questions from paper number 3 used to come in paper number 2 and questions from paper 2 used to come in paper number 3. But it wasn't like the entire paper used to swap. No, 1 or 2 questions used to come here and there. This is what I want to tell you. Okay, So sometimes in some universities, if you see recent advances, they are also included in all the 3 papers. Okay, they are also given in all the 3 papers. For example, recent advance of the HEMAT, they come under paper 3. Sometimes it might come in paper 3 as well. So that is why, you know, what you can see over here, if you see, that is why it is very important that you know something of everything. It should not be like, you know, you spent all of your time reading in depth about systemic pathology only, whereas systemic pathology is only one part of your exam. If you divide the exam into 4 parts, one part is systemic pathology. But if you keep on reading systemic pathology in details, okay, you will end up, you know, consuming your entire time and you may not be able to complete the other parts. So this part is very important to understand, that you have to know something of everything. That is very important. Okay. Now NMC is saying that the paper pattern is that there should be 1 long answer question and 6 to 8 short answer question. Now this might vary according to your university, and you should follow what is followed in your university. For example, in our West Bengal University of Health Sciences, if you see, they used to give 10 long answer question. Each long answer question was 10 marks. Okay. Now, for example, it might be completely different in your university. So this is the NMC guideline. Your university may not be following the NMC guideline, so you follow what is followed in your university. Okay, the pattern that is coming, you know, repetitively in your university, you follow that pattern. Okay. Coming to the practical component over here, this is just a brief outline. I will discuss all the topics which are important for the exam separately. So the practical examination, the NMC have said that the examination has to be conducted over a period of 2 days. Okay, and they are having, you know, around 4 important components of the practical exam. So the first component over here, there is the histopathology carrying 150 marks. So this is comprising of your slides, okay, 12 to 15 HPE slides, grossing as well as autopsy, okay, as well as the museum specimen. Then number 2 is your cytopathology, okay, and cytotechniques or tissue processing part, which is comprising of 80 marks. So over here you will have some cytology slides, 5 to 8 cyto slides, cytotechniques. Okay, what are those techniques? What are the things covered under that? I will, explain everything about that. Okay, and as an exercise, you might have to perform a special stain as well. So this carries, around 80 marks. Third component is your hematology, clinical pathology, blood banking, which carries 120 marks. And I would also like to add or make a small addition over here, that is your biochemistry. That is your biochemistry portion as well, or the biochemical test as well, which is forming a part of clinical pathology only. Okay, so 120 marks, okay, will be based on hematology, clinical pathology, blood banking. So over here again the slides will be there. Okay, hemat slides, certain exercises or problem cards mainly based on clinical pathology. I will discuss the important exercises. Okay, you might have to do the blood grouping, cross match, Coombs test, gel card interpretation. You might have to perform them. These are the blood banking exercises that you might have to do. Okay, blood banking exercises that you have to do. Okay, and the third important and the fourth important component, which is carrying 50 marks, is your grand viva, thesis, and certain charts from the basic sciences. What are the charts? I will also discuss them. So this is just a broad division of a broad outline of everything. Okay, of how the practical examination will be conducted and what are the components and how much marks they carry. Okay, now after having understood this part, now I will go into details of the individual section. That is first the theory. So first of all, about the theory, okay, the most important thing is you should never underestimate theory. Remember one thing, 99% of residents who fail the MD or the DNB examinations, they are mainly failing, okay, in your theory exams. Okay, it is in the theory exam that you fail, not the practical. Even the worst of the worst students, okay, they pass practicals, but it is the theory where they fail. So do not underestimate the theory. So that is why it is very important for you to read your theory very nicely, because in the practicals you can ask someone, you can, teachers can help, something can be done over there. You can at least say something, because in the 3 years you were practically present in the department, so practically you will be able to do something. But theory, if you don't know, you cannot write, you just cannot make up in theory, and especially in pathology. So what is the approach? I have always maintained this. First, you have to solve the last 5 to 7 years question papers of your college or your university. Once you complete these many questions, then you go for the remaining important topics. Now over here what I have done, that I have discussed or outlined some very important topics, okay, and these topics have already been some of them have been shared in the WhatsApp groups. So those lists has been shared previously, and I have added some more important topics which were missed in them as well. So I will be highlighting these topics. Okay, right now I will go slowly. If you have a pen and pencil or a pen and paper, sorry, you just write down these topics, or you take a screenshot of this. Okay, you take a screenshot of this so that you understand that what are the important topics that these are the must do topics that you have to complete. Okay, so the first very important thing are certain topics which are coming from the systemic disorders or systemic disorders. Okay, 100% they will be asked to you in the exam, 100% chance of coming for these questions, and these are the questions which is going to help you to pass. Okay, because they are quite easy, and most of the students, they read these topics, and these topics should not be missed. So I repeat, these topics should not be missed, and each and every of these topics have been completed in details in our application, in our website, in our course. Okay, so you should be ready, and all the notes have already been provided, both the hard and the soft copies. So what are these topics? Okay, diabetes mellitus, atherosclerosis, myocardial infarction, Alzheimer's disease, obesity, alcoholic liver disease, non-alcoholic fatty liver disease, SLE, HIV, amyloidosis, prions disease. What is not covered in the groups that I have shared some list, hypertension has been missed out. Okay, so please, if you have not covered hypertension, please cover hypertension. That has been covered in our application as well. Pheochromocytoma, Men's syndrome, Down syndrome, Klinefelter syndrome, Fragile X syndrome, cystic fibrosis, familial hypercholesterolemia, phenylketonuria. Okay, this was not mentioned. You have to this has been asked in the exam. Vitamin D deficiency, again these two topics which have been underlined, okay, or marked in red. Okay, this have been missed, so please take a note of this, phenylketonuria and vitamin D deficiency. Gaucher's disease, okay, then we have Marfan syndrome, cardiomyopathy, ionizing radiation, radiation carcinogenesis, diet and cancer, peptic ulcer disease, polyps, okay, in the GIT, inflammatory bowel disease, maltoma, TB, ARDS, iron deficiency anemia, megaloblastic anemia, pernicious anemia, AML, ALL, CLL, all the leukemias, MPAL, mixed phenotype acute leukemia, CMML, JMML, Hodgkin's lymphoma, adverse blood transfusion reaction, SID, sudden infant death syndrome. Okay, so all these are very, very important questions for your exam, and these questions are asked year on year, repeated questions, high yield questions, they will be asked. If you miss these questions, okay, it becomes very difficult to pass the exam. Then we have also covered, we have a special section on organisms, and trust me, organisms are asked, and the beauty of organisms is that they can be asked in any of the paper. Organisms can be asked in paper 4, paper 3, paper 2, tissue processing also can be asked anywhere. Okay, so what organisms, okay, which is very important, lab diagnosis of malaria, dengue, rhinosporidiosis, aspergillosis, leprosy, Kala Azar, mucormycosis, actinomycosis, filariasis, novel coronavirus, COVID-19, all these have been covered in details in your application. So you just have to go and see these lectures, watch the lectures, and you just have to read the notes. Watch the lecture 1, clear your concept, then you revise from the notes only. Okay. Now, apart from that, mercury and lead poisoning, okay, you have to read them. Tobacco effects, okay, alcohol effects, effects of alcohol. This has been covered in alcoholic liver disease also. Kwashiorkor and marasmus, that is malnutrition. Okay, viral hepatitis, again very, very important. This has been missed. Viral hepatitis has been missed in the systemic disorders, okay, list that I have shared in the group. So remember, viral hepatitis very important. Men's syndrome also. So these are the different questions from the systemic disorders, which are very high yield questions which will help you to pass. You cannot afford to miss them. Okay, and the ones which are shown in red, which are underlined actually in red, they are actually not mentioned, so please cover them. And the ones which are written in red also, they are also not mentioned, so please cover them. Now I am going to come to the systemic pathology questions. Okay, systemic pathology questions, I am going to give you a guideline, okay, that what are the things that you have to cover. So the number one thing, from where in every exam 1 or 2 classifications are asked. like classification, classify vascular disease, or classify ovarian tumors, or classify the testicular tumor, germ cell tumor, bone tumor, cartilaginous tumor. Okay, classify gestational trophoblastic disorders. Okay, so classifications are very commonly asked. Okay, classify lung tumors. Okay, according to the latest WHO 5th edition. So classifications, if you have read the classifications, you are going to get 1 or 2 questions from classification. Okay, and this is very easy. Now remember, the WHO 5th edition classification in toto you don't have to remember. Simplified versions are given in Robbins, and I have also discussed in my lectures. So always remember the basic, because you will not be able to remember each and everything from the WHO 5th edition classification. So broad headings have to be remembered. So Robbins is the best to remember. Okay, at least you will be able to write something if you remember, and classifications will come. Then the question on the grossing, write down the steps of grossing: thyroid grossing, uterine corpus grossing, okay, ovary grossing, thyroid grossing, okay, colon, colorectal, colon and rectum grossing, okay, appendix, gallbladder. So grossing, again, write down the steps of grossing, is very commonly asked in the exam. So one question from grossing 100% will be there. Sometimes 2 questions also come. Okay, all in all, just with these 2 only, you can cover 2 to 3 questions in your exam, or 20 to 30% of the systemic pathology question can be covered from this. Then there are certain questions which are age-old repeat questions. Small round blue cell tumors. Okay, sometimes they will mention small round blue cell tumors of infancy. Okay, if they do not mention, then you have to discuss those in adults as well. Then there is very important upcoming question: round cell sarcomas of bone and soft tissue. IHC of soft tissues. Okay, then very importantly, WHO 5th edition changes. They will ask you to write about the updates: FGT update, okay, MGT update, okay, testis update, kidney update. Separately they can ask you skin update, okay, hematolymphoid updates. Okay, all of these updates have been discussed separately and also incorporated slowly. They have been incorporated in relative sections as well. Systemic disorder question: what systemic disorder? That I have already discussed, the systemic disorder questions. Okay, so they can also come. They usually come in systemic pathology part, but systemic disorder questions, okay, they can be asked anywhere, starting from paper 4, 3, 2, 1. Okay, all these questions that I have discussed over here, they can be asked any and everywhere. Okay, then very importantly, staining. Okay, one staining will come 100%. They will ask you H&E staining, or they will ask you PAS staining. And remember, usually the staining questions, they can again come in any of the paper. They might give in, as a short note in paper 1 also, paper 4 also, 3 also. Similarly, IHC marker, for example, Ki67 they have given. Okay, any of the IHC marker or cytokeratin they have given. Okay, so they can give as short notes also. Then very important, just like as I told you that these 2 questions, as I have already mentioned, I am just marking in green. Classifications, grossings I have marked. Similarly, molecular pathogenesis also. One question from molecular pathogenesis will come in your exam. Okay, so for example, the latest endometrial carcinoma, okay, or ovarian carcinoma, or breast carcinoma, okay, or molecular pathogenesis of bone, or salivary gland, okay, or for example, molecular pathogenesis of thyroid. Okay, so one or the other molecular pathogenesis, this is just etc. I am telling you. So for all systems, the molecular pathogenesis is very important. For the CNS, for example. Okay, so one question from the molecular aspect, one question from the grossing, one question from classification, they will be 100% there. Okay, so just be very smart. One question from systemic disorder can be there in this paper, or it might also be repeat systemic disorder question can be there. So systemic to already will be there. Okay, systemic will also be asked. Systemic question will also be there. Systemic disorder, one question will be there from there, 100% will be there. Okay, then a question can come from the syndromes like FAP syndrome, familial adenomatous polyposis, Peutz-Jeghers, HNPCC, hereditary breast carcinoma syndrome, RCC syndrome. Okay, or a question from neuroblastoma, pediatric renal tumors, again very common, repetitive question, rheumatic fever, endocarditis, approach to a diagnosis of lymphoma, or approach to mediastinal tumors. All these notes are present under downloadable resources. Now I am coming system-wise important questions which are asked. Obstructive lung disorders, diseases, where you have the COPD, asthma is also there, okay, bronchiectasis is there, then pneumoconiosis, pneumonia, sarcoidosis, lung carcinoma, paraganglioma, cynonasal neoplasm. Now remember those that I have, highlighted with red, that means they are very commonly asked. Gastric carcinoma, colorectal carcinoma, malabsorption syndrome, microsatellite instability, autoimmune hepatitis, metabolic liver disease, okay, hepatocellular. So metabolic liver disease encompassing everything, okay, including your, hemochromatosis as well, okay, HCC or alpha-1 antitrypsin deficiency. So these metabolic liver disease not very commonly asked but might be asked. Hepatocellular carcinoma again, pancreatitis. Now again, very important mechanisms of glomerular injury, RPGN, PSGN, RCC, okay. Then very important thing is about the RCC, they ask, one important question again they are asking is the hereditary syndromes. Okay, so hereditary RCC syndrome or hereditary breast carcinoma syndromes, they are very commonly asked as well. And over here I forgot to tell you the molecular, yes, I have already mentioned for breast also, molecular pathogenesis for breast carcinoma also. Then one question, okay, again, just like I had marked over here, one question from classification, grossing, systemic disorder, molecular pathogenesis, one question will come from the biopsy, liver biopsy, renal biopsy, muscle biopsy, to name the important ones, okay. Then your lupus nephritis, IgA nephropathy questions can come, testicular carcinomas, especially tumor, the germ cell tumor, BPH, prostatic intraepithelial neoplasia, PSA, GC-NEC, and very important is the Gleason and the grading. I forgot to mention over here, but one part should be the gradings, the different kinds of grading that is there. I completely forgot to mention the grading. So what are the grading? For example, the Nottingham grading or the Fuhrman's grading or the Brandwen's grading, okay, for mucoepidermal carcinoma. So all the different gradings that we have discussed, okay, or all the index that we have discussed, they might be asked to the full, as a LAQ, or the Fuhrman's grading or the FNLCC grading in the soft tissues. So all the gradings, okay, please remember one question can directly come from the grading itself, direct question from the different gradings, okay. Then from the ovarian tumors, okay, germ cell tumors are important, uterine, okay, endometrial tumors are important, cervical carcinoma is important. Among the cervical carcinoma, one question which very commonly comes is the molecular testing of HPV, okay. Then your gestational trophoblastic disorder is there. Now again, one repetitive question that is always common is the prognosis of breast carcinoma, prognosis of melanoma, okay, very important. Breast carcinoma molecular I have already discussed previously, okay, and melanoma as a whole is an important topic. Then as a update, previously also it has been asked, gastric and pancreatic neuroendocrine tumor update. Thyroid as a whole, basically you read everything about the thyroid. Usually the questions are not coming, it is the undergraduate level topic, but you just have a basic reading. Molecular part is very important for the thyroid. And in the thyroid, one question which is repeated is the variants of the papillary carcinoma. Is the long answer question. Variants of your papillary carcinoma, just remembered right now, okay, this is an important question. Then you are having the very common squamous cell carcinoma, basal cell carcinoma, melanoma, precursor lesions in the skin, nevus, vasigobulous lesions, very commonly asked question. Adnexal skin tumor, again very commonly, classify adnexal skin tumors, very common question. Then the bone tumors, among the bone tumor I have, I'm marking with red. Again, bone tumors are very commonly asked question. Among the bone tumor is the classification, and very importantly they ask you about the giant cell containing lesions of the bone, or in general giant cell containing lesions of the soft tissue and bone together. Then other important questions is the molecular aspects of soft tissue tumor, okay, all the different tumors and the related molecular rearrangement that is there. Example in your Ewing sarcoma, okay, all the different tumor, the molecular aspect. Then your rheumatoid arthritis, osteoarthritis, Paget disease, they might be asked but not very important. Reactive lesions of the lymph node again is important. Muscular dystrophies, peripheral nerve sheath tumors like neurofibromatosis, schwannomas, retinoblastomas. So these are the different list, but I have also highlighted something which I have marked in red that has to be completed first. Then the other questions you can go. So the approach should be, first you have to complete the last 5-year questions or 5 to 7 year questions. So among that, a lot of these questions will be covered. After that, okay, whatever questions are remaining from this list that I have given you, cover them. And after covering everything what I have given, if still you feel that some more you want to read, then you go for further reading. Okay, so this is the approach. So this is the most important questions for the systemic pathology. Then for the general pathology, okay, to be very frank, very honest, you should not leave anything for general pathology. Every topic is important, and general pathology is the only paper which is predictable, you can predict completely. There is nothing right and left in general pathology. All same questions, repeated questions, they are coming, and you can score, you can score 100 out of 100 over here. That means to say that of course they are not going to give you 100 marks totally, but all the 10 questions will match in general pathology, or all the questions will match. So again, the concept is the same. First 5 to 7 year question paper, then you go for every important topic of general pathology. So general pathology ideally should be completed in entirety. But remember one thing, first you have to cover 5 to 7 year question papers of all the different subjects. It is not like that 5 to 7 year you have completed general pathology, now you are going for other topics for general pathology as well. No, 5 to 7 year general pathology when you are doing, after that you have to cover 5 to 7 year of systemic pathology, 5 to 7 year of cytopathology, hematology, clinical pathology, recent advanced. After that, when you have time, then you go for the extra topic that you have yet to complete. This is what I mean. Okay, please understand these points very carefully. It doesn't mean that systemic pathology you have covered 5 to 7 years, then you went to all the other questions of systemic pathology that you are not, and you left everything. Because as I told you, any one topic is not comprising a very big portion of your exam. They are only part of the exam. So a person who knows something of everything is the gold medalist in MD or the DNB pathology exam. Now coming to the cytopathology or hematology or clinical pathology, remember over here the important questions which are always asked, okay, is the updated reporting protocol. Bethesda thyroid, Bethesda cervix, okay, they will ask you the updated Milan system of reporting, and there are 7 or 8 systems. Okay, Paris system of reporting is there. Okay, so we have our Milan for the salivary gland reporting is there. So basically the different updated systems, okay, the latest 2023 whatever has been updated, it is there in the application. There is a section of cytopathology reporting protocols. 100% question will come from there. What are the other questions which can come? Quality control, QC. Now QC mainly I have discussed for hematology, clinical pathology. Okay, whatever is discussed will suffice. Even for cytology that will suffice. For histopathology, again it is very important. QC for HP is separately given in your Bancroft. So please cover from there, and we have also covered in the tissue processing section. So QC for histopathology. So one question from QC will be there. That is quality control, quality assurance, all the ICAS, ECAS, everything you have to cover. Then you have LBC, liquid based cytology, cell block preparation. Again, this question is very commonly asked. That is immunocytochemistry of unknown primary. Biomedical waste management, again very common question. Proliferation markers, differential diagnosis of jaundice, the urine examination, very, very important. The different organ function test might be asked, but it is not very common. Okay, it is not very common, Just read it. Okay. What is important is one question on CSF analysis, semen analysis, infertility, or fluid analysis question can be there. An approach to coagulation disorder. Okay. Pulmonary function test, thromboelastography, ROTEM, APLA syndrome. Okay. Blood banking, any one question can be there. I like adverse blood transfusion reaction. I have discussed the entire blood banking in very short. You cannot leave anything from there. Autologous blood transfusion, HSCT, okay, all these HLH syndrome, all these are discussed, and I have already, some systemic disorders like leukemias and all the important questions have been covered under systemic disorders, which I am not repeating over here. Okay. Then you have HSCT, HLH syndrome, IgG4 disorder, all the important anemias like thalassemia, sickle cell, hereditary spherocytosis, immune hemolytic anemia, the warm, cold type, okay, PCH, PNH. Approach to hereditary hemoglobin disorders. It is a separate topic, always comes in the exam. I have already discussed it in details. Automated cell counters. Automated cell counters you have to understand. Okay, bone marrow aspirate biopsy, again one LAQ can come. Okay, steps of bone marrow, what are the indications, write down the procedure, what are the sites, what are the complications of the procedure, what are the information that you are getting. Okay, so question can come separately for aspirate, can come separately for bone marrow biopsy, very commonly asked LAQ. Automated cell counters also is very commonly asked in the exam. Now the different latest techniques like electron microscopy, immunofluorescence, immunohistochemistry, PCR, flow cytometry, FISH, tissue microarray, next generation sequence, Sanger sequencing, cytogenetics. These can be asked in any of the papers. Okay, usually in paper 3 they ask, but they can be asked any and everywhere. Usually most of the sequencing and most of these questions they are asked in paper 1. But you see, for your university, you please go back and you see in which paper they are asking these questions. But usually they are asking paper 1, because NMC has given them in paper 3, so I have discussed here, but usually in our university they used to come in paper 1. They are part of basic science. Okay, then you are having the tissue processing part, like for example fixatives or your cryostats, or the different like decalcification is there. So different parts of tissue processing I have discussed, so any of them can come in your exam. Cytochemistry, very recently I have taken out video. For example, they will give you MPO staining as a question, or Sudan Blackby, or they might give you PAS in role of PAS in cytochemistry. Okay, so they can give you as separate questions like this. Artificial intelligence and digital pathology, again questions can come from there as well. So with this I have given you a brief idea, and leukemias and everything, they are important. Iron deficiency, megaloblasts, they are important, and they are given as a systemic disorder question. Means a systemic disorder question can come any and everywhere. So that is why I have not given specifically for this, but usually they are asked in hematology only. But they are very important. I have separated them out. They are really asked in your exam. Now, apart from all the questions, what more can be asked to you? Theoretical questions from your research methodology course that you have done, biostatistics that you have done. So you might be having a small booklet. So questions from that might come. A course on your ethics that you have already done, course from that can be done, and certain questions from ACLS and BCLS can also be asked. Okay, they can also be asked. And lastly, you are having the recent advance. Now for the recent advance, there is a recent advance histopathology and hematology, and for the histopathology you please read recent advance 23, 24, 25, and for the hemat you read, and very sorry I forgot to include recent advance 26, and for the hemat recent advance 1, 2, 3, 4. Okay, along with that recent advance journal club topics which has been discussed in your college. So whatever the list of topics are there for the last 1 year, okay, please do those topics as well as the WHO 5th edition updates. Okay, and along with that systemic or any other question, especially the questions from the tissue processing, or for the immunohistochemical marker, or cytochemistry stain, or any kind of a special stain, or any short notes, they are included in the recent advance or the paper 4. In the paper 4 they include them. Or systemic disorder like diabetes mellitus question can be asked in paper 4. Okay, it should not be, but they are also asked. Okay, now very importantly, 23, 24 as well as recent advance 1 through 3, the hemat, most of the short notes have been covered under downloadable resources, else the PDFs are already there. So how to read the recent advances, I will tell you when I will discuss about the how to plan your studies. Okay, so I will discuss about that in detail as well. So right now I am just discussing what are the different sources and from where you have to read and what is asked in your exam. So this was mainly for your theory. Okay, so these are all the important topics for your theory that I have discussed. Now for your practicals, please pay a lot of attention over here. For your practicals, okay, the first thing is your slides. Okay, and among your slides, remember the slides are basically asked from your histo slides are there, cyto slides are there, hematology slides are there, including that is the peripheral blood smear, and including your bone marrow aspirate and bone marrow biopsy slides can be kept for your exam. Now normally remember the slide list of which slides are important for your exam. It has already been shared in our exam dedicated announcement group as well as in the exam group. So basically the list is there, you just start seeing them. So that is the only list. Okay, there is nothing to be added or removed from there. It is the list, final list. And in your slides, marks are there. Some marks is there for writing your description and some marks is there for your viva as well. Now remember one important aspect over here for the practicals, that do not copy the description of your peers. Okay, and be very honest as to what you describe and what you see. If you honestly describe what you see under the microscope, and even if your diagnosis is wrong, okay, so even if your diagnosis is wrong, okay, diagnosis also I have to write. So for example, a particular slide is there, so basically 3 mark will be there for description, 2 mark will be there for diagnosis, 5 marks will be there for viva, so total is of 10. So although the diagnosis is wrong, you might end up scoring, your viva is very nice, your description is very nice. If the examiner is very happy with you, even with a wrong diagnosis, he might give you 8. And even if your diagnosis is right, but your description doesn't match your diagnosis and you cannot answer any question, you might just land up getting 3 or 4. Okay, 3 or 4 out of 10. Okay, so please remember, be very honest. Examiners, they hate dishonesty. They hate anyone who lie, and they hate anyone who tries to outsmart the examiner. Don't try to act smart in the exam. Please remember, I will tell you in the exam etiquettes part in detail. Now remember, for the slides, how do you prepare? One day before the exam, remember, you will not be able to see and go through all the notes, videos and everything together. So the best way to, before the exams, or just for, training your eye. Okay, so suppose there is a chapter histopathology, for example, you are going through the kidney. Now in the kidney, you know that which all are important exam slide. You just go through those, you go through those images. That's it. So for the histopathology, Robbins, for the cytopathology, orals, and for the hematology picture, just go through the Tejinder Singh atlas, but not the theory. Tejinder Singh theory is not good. Only the images are very good. So you just go through the images for the exam. And just to go through the images hardly will take 1 hour or 1.3, 1.5 hour maximum. Okay, so this is what you have to do. And the approach also to the slide comes from this. How? So for example, if you have got a particular slide, okay, and you have got it from a particular system. Now in Robbins, you have seen that these are the important 5-6 slides are important over here. And right now, just match the age. So if you match the age, then your approach can become very easy. Then even without looking at the slide, 50% of the diagnosis you will be able to make just by looking at which system and the age. Then once you look at the, the slide, then even in the low power view, you should go from the low power to the high power, because for example, you have got a nodular sclerosis, Hodgkin's lymphoma. So in the high power view, you cannot make a diagnosis. You have to go from low power. You see that nodules, okay, and then you can make a diagnosis of Hodgkin's lymphoma, NLPHL, okay. Now we come to the second important part of the practical, that is the clinical pathology, hemat, biochemistry. So what is very important over here, I would like to, discuss with you is the topics of the problem cards. So please do not panic over here. It is very, very easy. Okay. And problem cards, remember, I have already shared all the problem cards along with the answers. The solved problem cards have been shared in our exam group. Okay. And in the coming days, I will also share 19 to 20 more problem card. The new problem card that I have prepared, they will also be shared with you people. Okay. So, and basically about the problem cards, okay, just one thing I will tell you. Basically, every university or every college, they have their set, okay, 10-15 set of problem cards are there. And even before the exams, okay, your department will call you and they will show you all the problem cards and they will tell you, okay, they will tell you what problem cards will come, and those problem cards are repeated only. So it is not a very big deal. Okay, so in your department, if you ask your seniors who have already appeared or will be appearing for your exam, they will tell you that there is a list of problem cards are there. Now, among the problem cards, basically, what are the important topics that is usually, on which a problem card or a clinical scenario comes? Nephrotic syndrome or RH, hemolytic disease of newborn, nephritic syndrome, or an ANC mother has come. So your task will be to do a blood grouping. Diabetes mellitus case, okay, either HHS or diabetic ketoacidosis. A bleeding disorder person can come. That can be a case of an ITP or a factor deficiency. Diabetic retinopathy case. Iron deficiency anemia or megaloblastic anemia can come. Neuropathic ulcer case can come. Chronic hemolytic anemia can come. Eclampsia, viral hepatitis case, okay. Viral hemorrhagic fever, that is dengue, meningitis, even malaria can come. Lupus nephritis case can come. Or a GCSPD deficient case is there and the person has had a drug-induced hemolysis. So basically, individuals suffering from GCSPD deficiency, if they have the deficiency, and when they are under certain drugs like primaquine, okay, anti-malarials, so they can develop acute hemolytic episode. So that particular scenario can come. Acute coronary syndrome can come. Okay, like myocardial infarction case can come. Acute hemolytic transfusion reaction can come. Jaundice, different types of jaundice can come. Okay, you will be given a set of values. Okay, a set of LFT values will be given, and you have to write down what kind of jaundice it is, whether it is obstructive jaundice or hemolytic jaundice or hepatic jaundice is there. Okay, now urinary tract infection is again very important. Okay, a slide can come from urinary tract infection, problem card can come for urinary tract infection. Acute leukemia, okay, question, multiple myeloma scenarios can come. So basically what is happening that in the, so a particular clinical scenario, so the questions can come in two manners. It can either come as a clinical scenario wherein you have to write down the relevant investigations, and you might have to carry out certain tests also that will be part of your problem card. Okay, or the question can come that a person is there, clinical history is there, and these are the findings, these are the tests. So what do you make out of it? And then related questions to that particular diagnosis will be asked to you. Okay, so basically the first question that they ask you is what is the probable diagnosis, then what are the relevant investigations that you will do, and you might also be asked in certain situations to perform the investigation. So this is the biochemistry part. For example, the urine sample will be there, so you might have to perform urine protein in, test, or urine sugar, the same thing that you have done in your MBBS level, urine ketone body detection. So urine analysis is there. Okay, then for hemat, everyone usually have to do a peripheral blood smear. So the blood sample will be there. You have to make a slide. Okay, and then you have to prepare the smear, and then you have to examine, and then you have to write down, and you have to write properly how you examine a peripheral blood smear. The entire thing you have to write. Sometimes a hemogram will be given, 3-part, 5-part, 7-part strips will be there. You have to interpret them. Okay, then blood grouping you might have to perform. Coombs test sometimes. Okay, in rare cases you might be asked to perform Coombs test or cross matching as well. Usually blood grouping is asked to perform. Then you might be provided with a CSF fluid, or any fluid will be there, and you have to do the CSF or the fluid analysis, the cell type, cell count you might have to do. Okay, Newbar's chamber will be provided to you, so you have to do these tests. This is very much commonly asked. Okay, so this is about the clinical pathology, the problem cards, and the exercises that you have to perform. Then comes the grossing and autopsy. Autopsy, that is the post-mortem finding. So first, about the grossing, you have to perform the grossing with your own hands. You have to do the grossing in front of the examiner, and the examiner might ask the questions related to the grossing procedure or the gross differentials he might ask you. So the most important specimens which are kept for the exam, already you will come to know about that before your exam only. Okay, because they will keep them aside for the exam separately, and you will know. So usually they are keeping the big specimens like the breast, stomach, colon, ovaries, kidney, uterus, cervix. Usually they keep them. They do not keep a very tough specimen. Okay, so usually the larger specimens are kept. They will not keep, so an appendix and gallbladder, they are not kept. Although they might ask you questions from them, but they will not, that is not an exam specimen. Usually the bigger specimens. Now among the big specimens, one, you also have Whipples. So Whipples is a very difficult topic and usually not always available. So they will not keep Whipples. So it is very important, the basic and the ones which you deal with on a day-to-day basis, only those are kept. Okay, so it is very easy. Grossing is not difficult. Now for the autopsy part, and I will discuss over here that how you have to prepare for autopsy. Now till now I know that you must have gone completely mad and berserk. Completely, you must be thinking, sir, when it will stop, how much we have to read, there are so many things. And you know what happens, and every time I see someone is writing me that, sir, please start a separate autopsy series. There is a separate book on autopsy, and if I want to make, I can make a complete series of lectures on autopsy. But do you have the time, energy, and can you retain so much? So that is why currently, if you see, I have already shared a 4-page PDF in short, which is covering, okay, autopsy in short. Okay, and before the exam, this is very exam friendly. You will trust me, you will not have the time, energy to go and see and read about 1,000 notes and everything for autopsy. You will not have the time and energy. Okay, remember this point. In autopsy, basically two things are very important. One is the brain, one is the heart. Now brain, okay, whatever is given in this PDF, you read from there, and I have also shared a particular video. If you see this video and if you read the PDF completely, it is step by step. And for the heart, you see the dissection of the heart from Washington's manual. That PDF also I have shared. Okay, in the group I have shared the PDF. So this is more than enough for you people. Okay, this is more than enough. You will not have the time, energy to complete your autopsy in detail. Now, what is very commonly asked along with the autopsy, the post-mortem PM specimen, that is a museum specimen, the same specimens that you are having in your MBBS, that is they will keep a heart, rheumatic heart disease will be there, or infective endocarditis specimen is there, or colorectal carcinoma is there, or an ovarian carcinoma specimen is there, or a gastric carcinoma specimen is there, okay, neoplasms is there, or a myocardial infarction MI specimen is kept, okay. So basically whatever the museum specimens are there in your particular university, just go through those museum specimens, and among them around 10 specimens are kept for your exam. From there only they might ask you certain questions related to autopsy. So the list of these museum specimens, okay, it is not very it is not very clear in my mind right now. I will make a list and I will share the museum specimen list also in our exam group, okay. But what is very important is to know what are the common autopsy diagnoses. They asked you, this is a very commonly asked question. So cardiopulmonary failure, okay, then myocardial infarction, common diagnosis, autopsy diagnosis, pneumonia, neoplasm, pulmonary embolism, aortic rupture, cardiac tamponade, cerebrovascular lesions, sepsis, peritonitis, gastrointestinal hemorrhage, intestinal ischemia. These are the common autopsy diagnoses. And the list of museum specimens, it is the same like your MBBS. I will share with you. Okay, it is not very difficult. I will share you in our group. What are the list of museum specimens? Okay. Now the fourth important part is the tissue processing. So you will have to perform one H&E staining. You will have to perform one special staining, like example pass. You might also be asked, I was asked in our exam, I was asked to take sections with the help of microtome. And how will you mount the sections, okay, in your slide. So please make sure that you know these things. Now whatever equipments are kept over here, if you have a frozen section, cryostat is there, questions will be asked. All the tissue processing, the manual as well as the automated manual, as well as the automated tissue processors, okay, they will be asked. All equipment, whatever is kept, questions will be asked from there. So make sure whatever instruments are kept in your tissue processing unit, you are well aware of their working, and everything in detail has been covered in the tissue processing sections of our application. Then we are having the micro teaching. Now till now I think that you people have presented a lot of seminars, you have participated in the journal club topics, you have presented posters, so you have an art of speaking. At least you are now comfortable speaking in front of an audience, okay. Usually the topics for micro teaching, what they did with us, I'm telling you, they told us, okay, one day before or 2 days before the exam, they will tell us 10 topics. Okay, you will have to read all the 10 topics. And the day of your micro teaching, they will ask you to take a particular, they have kept, make a chit. They will ask you to take a chit. There will be a lottery. And whatever chit you get, that is your topic, you have to speak, and you are given 10 minutes to speak on that topic, okay, in front of your examiners. Then after this will come something called as the grand viva, or a separate viva for the charts can be kept. And it is not like charts I am saying, so it will be there. It depends and varies from university to university, but NMC has asked or has suggested for the chart. So what are the strips, what are the charts, and all these things have been covered in details throughout our course in separate places. So electrophoresis strips might be brought by the examiner. Osmotic fragility charts might be there, HPLC charts will be there, 3-part, 5-part, 7-part autoanalyzer strips will be there, flow cytometry charts can be there, platelet function test, yes, I have discussed, those graphs can be brought by the examiner, thromboelastographic graphs can be kept in the exam, gel card interpretation, blood banking, that can be asked, that also interpretation has been discussed. Then PCR, immunofluorescence chart, cytochemistry stain, they might just have a picture of that. IHC stain, they will ask you whether it is a cytoplasmic membrane staining or it is a nuclear staining. At least you should know that. That is the most basic thing they will ask you. Then they might go into the steps of IHC, okay, troubleshooting or something like that. Electron microscopy charts can be brought. Special staining chart can be there. PBS, certain important like sickle cell anemia, PBS chart can be brought by the exam. Or for example, reticulocyte staining is then, okay, that is new methylene blue staining can be done, okay, that is your live staining is there. So that might be brought by the examiner. The examiner might ask you that please diagnose what are these. Okay, and then the diagnosis can go, or the viva will go into the reticulocytes itself. Okay, and lastly you have the grand viva. Okay, and the thesis. Now in the grand viva, basically the examiners can ask you questions about any and everything. Okay, and they might ask you, and by this time, usually, by the time you give the grand viva, already you have given so many separate vivas, so the examiner knows what you know and what you don't know, and how much you are in water, the examiner knows. So accordingly your viva will go. And about the thesis, you will be asked to present your thesis. So please, before you go for your exam, practical exam, okay, please read what is the topic. At least read your topic correctly, discuss in brief, and have a exercise, have in front of the mirror. Okay, you just make a basic, you just write down a basic short gist of your thesis and present those points in front of our examiner. Often I see the students, they are fumbling in the exam. Okay, for the thesis work, they start to fumble. Okay, my topic is this, I did this, I know, not like this. Okay, so we have conducted a study, so and so, you introduce yourself. I am the first. Okay, my guide is this, my co-guide is this for this topic, and we are done our research work on this and this, and these are the salient points and these are the salient findings that in my thesis work. Okay. Okay, now after having discussed in details, right now we have just completed the components. What are the different components of the exams in details? Now in a very rapid way, we are going to complete what is the approach, how you will complete all these things. So very importantly, the most important thing that you have to do is that you have to multitask. Okay, multitask as in, do not only read general pathology whole day or systemic pathology whole day or any one subject whole day. No, you have to read multiple topics together. Okay, because as I told you, the winner is only that person who knows something of everything. Okay, so theory, as I told you, the approach is first 5 to 7 year question papers of all topics simultaneously. Why? Because since all the subjects are never ending, I have already explained about this point. Simultaneous word is very important. If you are doing general pathology 5 to 7 years, simultaneously you should also be doing systemic pathology, hematology, cytopathology, everything. I will show you the basic timetable of how you have to do them. Okay. First you will do this, and when you are reading about these 5 to 7 year question papers, you have to revise them as well. After all these 5 to 7 years is complete, for all the subjects you have completed, listed in the 5 to 7 years, then you go for all the topics which I have listed above. So suppose after you have completed the 5 to 7 years, okay, all these topics that I have discussed over here, all the theoretical topics, if you see that some topics sir has given and I have not done, first you complete these topics that I have given you, and 100% who is going to complete what I have given, 100% they will have the gold medal. 100% I'm saying. So 80% of also what I have said, if you complete them, you will pass easily, you will do well. Okay, and after all topics listed above have been completed, okay, you go for the more extra important topics. So this is the pathway that you have to follow. Now I was telling you one thing is very, very important that you should keep in the exam, especially for the exam going residents. Now what is happening that whenever you are in the first year, the faculty, they ask you very tough questions. So whenever you are, it is usually the faculty, they have read some topic, revised some topic, they have seen some latest, they have read some articles. So they tend to ask you some tough question. They will never ask you an easy question, because, they feel better by asking you certain tougher questions. So throughout your residency, what happens that you are used to, hearing tough questions, so that it goes in your brain that it is the tough questions only that will be asked to me, and you run after the tough questions in a very mad way. You will always concentrate on the tough questions. And what happens that when you come for your exams, okay, the faculty, the external examiners as well as the internal examiner, you will see that they will ask you very, very basic question, and you fumble, you cannot answer, you cannot define neoplasia. You don't know, you are not able to list the different adaptations and the mechanisms. You are not able to classify leukemias. All the basic questions you are not able to answer. Why? Because examiners have asked me this question, that question, this question. All the faculty have asked you so many hi-fi questions that by the time you come, you want to face the exam, you are that much fearful. you fumble in all the very basic questions. So please be very, till now, if that mindset is there, throw out that mindset, cover the basics, because the examiner will first start with the basics. Only after you answer, okay, all the basic questions nicely, so you have now scored 90% of the marks. For the remaining 10% marks, that is, the examiner will ask you the tough level questions. Remember this point. The tough questions are never asked in the first. And also, because you have read so many big things, so you think that I have a lot of knowledge. Then what happens? The examiner is asking you something, you start answering about those big things. And then the examiner thinks, okay, so he is showing his knowledge. Then the examiner, then your viva will go completely in a separate direction. And remember, the same two internal, external will be there. So if one viva has gone bad, again they will come in the next, third, fourth, and then it goes, haywire. So remember this thing. So what happens in the first 3 years, very tough questions asked by the faculty. So you do a very deep reading. In the end, what happens, very basic question is asked, but you forget the basics. And the most important problem that is there, even with this many questions that I have given you, and this many questions that you have to complete for your exams, what is happening that you cannot reproduce everything. So you have done so much of deep reading to impress your faculties throughout the 3 years. In the end, please remember, you will not be able to reproduce anything from there. And in the end, you will be sitting with our notes only, and you will be just going through the notes, and you will not have time for anything. So whatever you have read from very big books, WHO here and there, nothing will be there. So whatever we have taught and whatever notes we have given you, that will be the only savior for you in the end. Okay, so please keep that in mind. Okay, I am telling you, the first years and second years also, please keep this thing in mind. And for the practical exams, remember, whatever you have done in the 3 years of residency, that is going to be judged. Plus whatever you are also reading in the theory, that is also there. But mainly what you have done in the last 3 years of residency, that is judged in your practicals. Now the mathematical approach that I told you. So please listen to me. So if you are doing the 7 years question paper, okay, and in every question paper in every year there will be 4 set, right? Paper 1, 2, 3, 4, and every set is having 10 questions. So मान लेते हैं there is 7 into 10 into 4, so total of 240 questions. Plus after that, you have completed them, say around 60 more questions, important questions from whatever I have given, you have completed. And the total number of questions is around 300, right? So you have these separated 300 questions with you. So if you divide, and what we have seen that we are having 100 days. So if you start from today, okay, if you do 3 questions per day, then also by the end, all the questions, if you do only 3 questions also per day, your syllabus will become complete. This is what I mean to say, but this is not what I am telling you. This is the least amount of questions. Ideally, at least you have to do 10 questions per day. At least 8 to 10 questions you should do per day. So if you are doing 8 to 10 questions per day, then within 30 days, you can cover 300 questions. Now suppose if you don't do 8 to 10 questions, even if you are doing 4 to 6 questions per day, and remaining time you are giving for revision, okay, then the entire syllabus will be completed in 60 days. The reading will be done in 60 days with revision, I am telling you. And in the last 30 days also you can keep completely for your exam. So you have asked me for 3 months plan. I have given you in a very easy manner a 2-month plan, and I have given you 1 month extra also. So you are having a plenty of amount of time. So remember this point, you have lots of time, and so much time you are having after having completed the question paper and the revision of those questions. Please complete whatever we have given over here. So if you read them thoroughly, suppose in the next 20 days, for example, 60 plus 20 in 80 days total, you can complete each and everything that I have given you. So the remaining 18 to 20 days is enough cycle complete for the last lap of your cycle. So in 80 days, you try to complete. So the questions can get complete in around 30 to 40 days of time. Okay, all the questions can be completed. Apart from the questions, if you include the revisions also, in 60 days of time with the revision, 7 to 8 years question paper will be done in 60 days. In another 20 days, you can also cover with revision all the remaining portion which is left as well. Okay, so everything can become complete in around 80 days. So in the last 18 to 20 days is enough for your exam. Out of that, for example, you can keep 5 days for the general pathology, you can keep 5 days for the systemic pathology, 3 days for hematology, and the remaining 6 to 8 days for the remaining topics or the miscellaneous topics is more than enough. Okay, so for example, general pathology, this is for the last, for just before your exam. Okay, general pathology, systemic pathology, hematology. Okay, 1 or 2 day you can give for cytology, and then the remaining topics, recent advanced tissue pathology, tissue processing, grossing, everything in the remaining part you can give. So I have given you a mathematical approach also, that you have enough amount of time. Okay, and if you read very nice, this is to just I am saying 4 to 6 questions per day on an average, but a good student can cover 10 to 12 questions also per day. Okay, now coming to the timetable, I have discussed the timetable in multiple videos previously. The concept remains the same. You have to cover something of everything every day. So I have covered, the short forms are here. H is your heavy subject like general pathology, systemic pathology. L is your light subject, hemat, cytopath. RA is your recent advances. MS is the miscellaneous topics like the grossing, tissue processing, autopsy, clinical pathology, problem cards, etc. So for example, when you are starting your day in the morning, okay, 5 a.m. and this 5 a.m. is for those people, okay, for those people who have to attend their college and they are not free between 10 to 4, they are not free, mean they are in the college work. So I am giving the worst possible scenario. So for those people, ideally morning 5 a.m. you have to get up. Okay, and the first thing that you start, first thing in the morning is the revision. 30 to 45 minutes revision. Now revision doesn't mean that you reproduce everything in the mind again. No, revision means if you have read something in the previous day, just you go through with your eyes. So your brain knows, your brain is making a connection. That is what is the morning revision. While you are having a cup of tea, while you are just preparing to read, just go through the revision what you have read one day before in a very fast manner. Just your eyes should run through that. Then the first thing that you are going to take up is the 3 to 4 hours. That is from 6 o'clock till 9 o'clock or 9 and a half, whatever time you are getting, is your heavy subject. So suppose the first day you have read general pathology, the second day you take the next subject, systemic pathology, or you might read 2-3 days general pathology in continuity. After that you start reading systemic pathology continuity. So that can alternate. That is varies from person to person. Now suppose you are also working in the college. Okay, now if you are working in the college, then at least you have to take out 1 to 2 hours in your college hours, okay, to read either recent advance or any of the miscellaneous topics. Okay, you have to read in that time. Okay, and once you are coming back in evening, once you're coming back home after work, you take a break, and 5:30 p.m. or 6 o'clock you start for the light subject. Now light subject, for example, you read hemat or cytology. 2 hours you give for the light subject. And at night, now if for example you are you are not able, if at night after the light subject, okay, take some rest and read recent advances and miscellaneous topics once again at night also. Okay, if you do not get time over here, not a problem. So at night also you can read, but if you get time, you start covering these topics as well, because these topic in entirety, they form at least 1/3 of all the questions which are asked. Okay, 1/3 to 1/4 of all the questions come from recent advances and from miscellaneous topics. So they are scattered, but if you take them together, they are very important. Okay, so if you do not get time also, no problem. After light subject, you read recent advance or miscellaneous topic. Means, for example, if today you are reading 1 hour recent advance, then second topic you can take miscellaneous topic, half an hour you read. Some simple topic you read, but you have to read, mix and match and read. Every day you read recent advance, you read miscellaneous topic also. Now suppose day 1 you have read recent advance histopathology and miscellaneous topic you have read grossing. For example, I am saying. Day 2, for example, you read the recent advance hemat or recent advance 24 or recent advance 25 or 26. Okay, or you just complete the topics one by one. So similarly, day 2, you change your miscellaneous topic, you go for tissue processing or for autopsy. So like this, you keep on changing, because if you change, if you mix and match, your brain becomes, excited. When you have varieties of different kinds of things, your brain is engaging. You don't feel bored very easily. Okay. So the basic point over here is the day should start with your revision, followed by heavy subject. Okay, then it should be followed by lighter subject, and then in the end, the day should end with recent advance or miscellaneous topic. Now, ideally, if you add up the revision time, the heavy topic time, the light subject, and the recent advance and the miscellaneous topic, you should read 7 to 8 hours per day consistently. Okay, if you are able to read this much, and remember, the quality should be good. It is not like this much hours I'm sitting, but I'm covering very less. No. Quality 7 to 8 hours. If you sit every day consistently, a gold medal or distinction is 100% kept for you. Is 100% sure that you will get a gold medal for this. Okay. Now, before I go to the counseling and the tips and the last section, I will just tell you something about the recent advance, that how you should read. Now, remember, if you read recent advance with a lot of emotion, and if you invest a lot of time and energy in recent advance, you are not going to be able to complete, because recent advance, the language of recent advance is very tough. So how you have to read recent advance? Remember, after every topic of recent advance, in the end, there is a summary box. You start with the summary box to know what is that they are talking about. Recent advance, you have to just see the headings, just a gist. And if you can, in that time, you take a paper, okay, and suppose there is a chapter, 10 pages, and they are very, you don't have to go into the depths of the chapter. You write down the name of the chapter that you are reading. You just write down 1 or 2 points. Just write down 10-15 points. That is more than enough, and just read. And you will be able to complete each and every topic within 30 minutes or within 35 minutes or within 40 minutes. Many of the molecular aspects, okay, of the different systems like salivary gland, bone, as well as the lung, okay, as well as, breast, they are covered in the recent advances as well. So please do not leave or ignore recent advance, and read recent. Do not invest a lot of emotion, time, energy in recent advance. Means you have to take one topic, see the summary first, so you will be able to understand what they are talking about. Then you go to the topic, you take a piece of paper. In that time, just write down points, 1, 2, 3, 4, 10 points, 10 to 12 points are there from this chapter. This is it. I have to elaborate this in my exam. This is the only way. I will tell you, if you read recent advance in this particular manner, in the end, you will be able to revise recent advance in only 5 to 6 hours. Recent advances histopathology, recent advance hematology as well. Everything you will be able to reproduce in such a short period of time if you are reading in this manner. Okay, miscellaneous topics are very easy. Grossing, a single topic can, like grossing topic. Okay, if you see my video, none of them are more than half an hour. If you see the video and then you revise from the notes, 10 to 15 minutes maximum you will take for one grossing topic. So it is so easy. Okay, so that is why I've kept recent advance and miscellaneous topics in the end of the day, so that your mind is completely free. Okay, and most of your valuable time you have given in the heavy subjects, then light, and then the recent advances. So the basic thing is, if you read in this manner, you are not going to miss anything. Okay, and last but not the least, the counseling and the tips. Remember, the number of hours of reading is not important, rather it is the quality of reading that matters. Number one, very important thing for your day to become successful. For your day to become successful, the most important thing is, is what? It is that pre-planning a day before, 15 to 20 minutes pre-planning a day before you go to sleep is very important. Now, what is this pre-planning? I will tell you. Now, suppose tomorrow you want to read, suppose these 8 long answer questions, or these 8 questions, mixed match of long answer and SAQ questions, or whatever mixed match you are doing. Now, one day before only, you just make sure that where are the answers to those questions located. So I am doing this is in this part of the lecture, this is in this part of the note, this is in this part. So your mind is mentally prepared that tomorrow I have to do this. These are the sets of questions that I am going to target for tomorrow. And remember, whenever you are doing questions, like for example, you are doing 8 questions. So always do a mix and match, like 2 questions be very difficult, or 2 to 3 questions are difficult, but 3 to 4 questions are easy. Okay, and always whenever you start your day, you always start off with easy topics, so that once you complete easy topics, 2-3 easy topics, then if you go for a difficult topic, then what happens that you get into the flow, you have confidence. And very important thing is that have a proper 7 to 8 hours of sleep. 8 hours of sleep is minimum, very important. A good sleep, 8 hours you should have before you start your day. Then try to include physical activity, enjoyment, try to go out of home, keep yourself happy too. Go to, see some amount of cinema you can see, do something that is going to rejuvenate you. Because if you only are going to read and you are going to become fearful, your exam will become bad, because you will become exhausted in the end. And I have multiple examples of very good students who have faced this. First thing in the morning, do not touch the phone. Straight away go to the revision, get over with the heavy subject. Concentrate, very important thing. This is so important, especially among the girls. I am very sorry. I am not being, for example, I am not doing a differentiation between boys and girls, but girls, I have a very simple request for you. Please concentrate on yourself and your studies only. 90% of my counseling sessions that I am doing, they are with the girls, and they have either some problem with the department, or they have problem that they are worried that their roommates or their colleagues, they are reading more, they are doing more, they are doing this, they are doing that. Please concentrate on your studies first. Healthy discussion is all right. That means if you are sitting and discussing this is all right. But if it starts to affect your reading, affect your life and your mental, then please try to control yourself. Revision is very important, as I've already highlighted, and this is something which is different from my previous lectures of exam lectures. Revision, your day should start with revision, and I told you what is meaning of revision. Do not ignore revision. And remember why, for example, the most important counseling statement that I want to make is that please remember, this is the last opportunity to read so much, because once you pass, you get the degree, that enthusiasm of reading will not be there, the same that is now. So read with happiness, read with your open heart, read with enjoyment. Do not fear. See, at the worst, what want to happen? You might fail, you have to repeat. So वो बात की बात है, आज पढ़ लेना है, don't fear. और अगर फेल भी हो गया तो क्या होगा? दोबारा एग्जाम देंगे, पास तो होना ही है. There is not anyone who has not passed. And I am telling you, 100% everyone is going to pass, and you do not need Simply Pathology content for passing. You need Simply Pathology to become a good pathologist. Okay. So pass sab hote hain. Okay. In MD, the rate is very high, 99%. In DNB, the rate is little low, which now has become around 94-95% passing rate is there in DNB as well. So ऐसे पढ़ो कि यार ये तो last time है पढ़ने का. This is how you should read. And do not push yourself. ये भी बात जान लो. Remember one thing, this 90 days will not be like this, will not be like a plain linear graph. There will be certain good days, there will be certain bad days. ये मान के चलो. There will be days you will not be able to fulfill your target. There will be days जहाँ मन नहीं करेगा पढ़ने का, वो normal है. And that is something which is very usual. And when you will read so many things in a short period of time, you will tend to forget, and everything in your mind will be like, what is happening? I cannot reproduce anything. It is so difficult. Don't think. And if you are facing something like this, you are in the right track. When you don't understand what is happening, you are in the right track. Okay. Then you have to garner positivity. Please stay away from the news channel. Please stay away from any person who is going to spread negativity. जो आपको बोल रहा है ना कि ऐसा हो जाएगा, वैसा हो जाएगा, जो खुद भी नेगेटिव है और आपको भी नेगेटिव कर रहा है, उनसे दूर रहिए. The first important thing. And lastly, I am going to end with the exam tips. Please, in your exam, carry your admit card. Please don't forget to carry a watch. Carry your thesis for your practical. Your logbook is very important for your practical. Should be well dressed. Have a proper haircut, shave. The professors are always right. Do not argue with them. Okay, you don't argue, don't act smart. In the theory paper as well as in the practical, time management is very important. Okay, because you don't have habit of writing. So carry your watch, try to write, okay, as much as possible, and you write in a very concise manner to the point. Okay, sometimes if you do not know, fill pages also. Do not leave, if you don't know anything about any topic, just fill the pages. Do not leave it blank. If you leave it blank, you will not get even that 2 or 3 if you had just filled up that page. So don't leave anything blank, and carry your own microscope, okay, during your practical exams if you are allowed to. And practicals also you carry your watch, because time management is very important. So thank you very much for watching this particular lecture, and I hope that you have gained a lot of knowledge and a lot of doubts have been cleared, and I wish you all the very best for your exam. Thank you very much.